Hey, this is Dr. Reyes, Weight Control Medicine. A question or questions I often get from patients regarding the differences between the diabetic versions and weight loss versions. Um, are there any differences? And I understand the patients are sometimes reluctant to believe that there are the same medication. So I wanted to make this quick video, and that way it'll be helpful. So you can see right here on this slide, these are the injectable medications for weight control, not necessarily FDA approved because of how they're named or how they're developed, but they do cause weight control or weight loss. So these will include both the diabetic versions and also the FDA approved versions of them for weight control. So let's start with the first one there, Saxenda. Saxenda is also known as Victoza. The generic name is called liraglutide. So what's the difference between Victoza and Saxenda? First of all, they're made by the same company, Novo Nordisk. Their delivery system is exactly the same. It's a multi-dose needle. The difference is the dose. So Victoza would only go up to 1.8 milligrams daily for diabetics, and that was approved way before 2010 was when Victoza was approved. Saxenda then came out years later in 2014 as the weight loss medication, and 4 years later, and it went up to 3.0. And so that's what Novo Nordisk, as they tested it at a higher dose, got the approval for weight loss, and that's what you see there. I didn't put Victoza on this slide because it's rarely that anyone uses Victoza for weight loss. It's really, and it's I don't know if anyone really prescribes Victoza anymore for diabetes, just because the weekly version is so much better now. It's superior. So the history of it is Novo Nordisk, the company that made Saxenda and Victoza, then came out with the weekly version in response to Lilly's Trulicity. So I didn't put Trulicity on this slide. I'll get back to that a little bit later. And they came out with Ozempic, which is you see on the third line there, and they geared it towards diabetes first. And so what's the difference between Ozempic and Wegovy? They're exactly the same medication made by the same company. The delivery system is different. So Ozempic is a multi-dose pen, and it only goes up to 2.0 milligrams. So the other difference is the dosing. So what the silly part of this is Wegovy, the weight loss version, goes up to 2.4. Okay. But because they got it approved for weight, so Novo did the same play, right? They started with diabetes and they said, oh, that causes weight loss, so let's focus on weight loss, so let's retest it at a higher dose. And through whatever marketing, I think it was from Lilly's marketing, who was doing Trulicity, everyone started moving towards the single injection strategy. So Wegovy comes in 4 pens per month and it's single injection. So it's a different delivery system, same exact med. Do I have patients who tell me, oh, I felt different on Wegovy than Ozempic, and Ozempic or Wegovy? That's more of a perception issue. They're exactly the same medication. All right. They're made by the same company. It's just delivered differently and branded differently, but they're exactly the same, with the dosages being slightly higher for Wegovy. So the history of it then, during that battle, during the time of Ozempic and Wegovy, Novo Nordisk and Lilly were fighting over the diabetes space, and Lilly had come out in response to Victoza with the weekly diabetic version called Trulicity. And Trulicity was a single injection pen. I didn't even put it on there because the weight loss on it is so weak, and the medication would run off by day 5, and they had no weight loss indication with Trulicity. And so once Ozempic came out, that became the go-to. I called it King Ozempic for the longest time because it was far superior than Trulicity. But then Big Lilly came in and decided to beat up Novo Nordisk with Mounjaro. Mounjaro came out, single injection pen, and tremendous weight loss in their trial with, it was the first one. Their big headline was achieving 21% or 20% weight loss, which is on the same level as gastric bypass. So they call it the non-surgical solution for weight control. And Mounjaro came out for diabetes first. Were people using it for weight loss? Yeah, they were using it for weight loss. And then a few years later, because Lilly was on top of, they started seeing, oh, why are we waiting to get diabetes done and then do a trial for weight? So Lilly was smart. They did them close to simultaneously. And then it got Zepbound approved a year later in 2023. Mounjaro was approved in 2022. Pretty awesome with that medication. But for the sake of that common question, is there a difference between Mounjaro and Zepbound? There's no difference other than the FDA approval. The medication is exactly the same. Is there a difference between Ozempic and Wegovy? The medication is exactly the same. The only difference is the dosing. How high can you go? And the delivery system is different. Ozempic is the multi-dose pen, which I love. And then Wegovy is the single injection pen, which I hate. Mounjaro and Zepbound actually use the same delivery system as Trulicity. It's that single injection pen. It's the same pen that if you're a migraine patient that uses Emgality, it's the same pen that they use there. And unfortunately, that's one of the causes of the shortages of the medication is the single injection pen. Hey Lily, if you happen to be listening to this video, why don't you guys consider releasing to the US the multi-dose pen that you've released in UK or in Canada? It would be nice. I would really appreciate it as a physician that we would have a multi-dose pen of Mounjaro or Zepbound here in the US, and maybe that'll shut down on the shortages. And that would probably make things a lot easier for my patients. So if you're listening and Novo Nordisk, please go back to the multi-dose pen. It makes things a lot easier when we're dealing with these shortages. So I hope that helps, guys. Leave your comments on the bottom. I'll see you at the next video.